Yeah, so we are live. Good morning, Dr. Neelu Agarwal, and good morning,
Hi,
everyone.
Aarti.
Hello,
Good
ma'am.
morning, everyone.
It's a pleasure having you on this call today. Hello,
Mhm.
everyone, and hello, everyone, to this live streaming facility that we're having with our patients. Today, we're going to talk about a special topic of Puerperium, and we have Dr. Neelu Agarwal, who is an intern, who is a senior consultant with Apollo Hospital. She's an obs and gynae and also a fertility specialist, and she's specialist in this topic. So she's going to tell us about the whole thing. Ma'am, it's all over to you and have a
Thank you,
thank you.
Aarti. And I hope I can speak on some of the basic concerns during puerperium. So, uh, we'll start what puerperium is. So, puerperium or a postpartum period, also commonly known as sutak in our country, it is the period of time following delivery of a child during which the body tissues and especially reproductive system reverts back to pre-pregnant state, both anatomically and physiologically. So, what are the stages of puerperium? So, we can discuss about that. That it's an immediate, an early, and a remote time. Immediately is the first 24 hours after delivery when the acute post anesthetic complications while doing a cesarean section or a post delivery complications in a case of normal delivery they may occur. Then there is an early puerperium, which is a period till the first week of delivery. And then a remote, which includes 6 weeks post delivery. So these are the divisions of the puerperium, and there are different concerns during these periods. So we can discuss about it, or if you have any doubts about that period, what has to be done, you can please ask questions on that private chat. So I can address them in the end, basically. So now dealing with the anatomical changes, we'll discuss very special चीजें जो जैसे कि those which are concerned with the patients. Uh, let's talk about the bleeding part. The main problem is, doctor, how much bleeding is going to be there. What is the concern if heavy, what is heavy bleeding, which is light bleeding, is this bleeding normal or not? So it's a discharge, also commonly known as lochia, which occurs after birth. It is divided into three parts again, and a rubra, and then serosa and elba, basically. So rubra is the immediate bleeding which occurs post delivery. It's red in color, bright red, and then gradually it changes color. For the initial 3 to 4 days, it's bright red in color. If it is increasing, if it's persisting more than 3 4 days, so it may be because maybe retained, some parts have been retained or some membranes have been retained, and in that case intervention has to be done. It has to be reported to the concerned authority, basically. Then what is serosa? Serosa is pinkish or brown in color, and it happens 3 to 10 days postpartum. Then it becomes yellowish or white in color, known as alba, and it remains till 6 weeks after childbirth. Lochia generally increases with ambulation and with breastfeeding. A look then it is not to be foul smelling. If there is some kind of a foul smelling coming, please inform the doctor. There may be some kind of remnant, there may be a gauze piece which has been retained, so it has to be addressed. It should be a orderless, basically. Then another common complication या complaint post delivery is a cramp like pain. Many patients says, डॉक्टर अभी डिलीवरी हुई फिर से वैसे ही दर्द आ रहे हैं, क्यों आ रहे हैं, कुछ रह तो नहीं गया है, कोई प्रॉब्लम तो नहीं है. So what is this? This is an after pains. It's a very common entity which is usually increasing with breastfeeding, basically, and whenever child feeds, the pain increases. It is constant and occurs after suckling, and it occurs immediately postpartum, and it decreases after 2 to 3 days. They are regular and coordinated. So it's a common complaint, and it is easily resolved with taking a good painkiller. Another common complaint is a constipation. Constipation, which is very common because of so many hormones, there is gastroparesis. So the movements is slow. Bowel movement is very slow. The During delivery, there is an interrupted food intake. During cesarean, you're almost not eating for around 24 hours. So there is an element of dehydration during labor. Relaxed persistent muscles causes painful defecation also. So, fear of pain after delivery and episiotomy, all these are all common complications of leading to constipation. It can be treated by removing all these cases, causes, like we can give a good painkiller, so pain and everything is okay. Good diet, especially like papitas and everything. Then lots of drinks, and if needed, a laxative may be required for the initial 1 to 2 weeks, and then the patient generally regains control in 4 to 5 days. Also, hemorrhoids, which is very common during pregnancy, they decrease in size post delivery, and in around 6 weeks, they get treated basically. Now, let's talk about some kind of a urinary system. What happens during about the urine and everything. Post delivery, normal delivery, passing of urine is very important in within 3 to 4 hours of delivery. Why? Because bladder, if it increases because of again because of increased steroids, because everything is slow, the bladder fills and then it pushes the uterus up and leads to difficulty in contraction of uterus. So the bleeding may increase. So a periodical passing of urine is very important. Within 12 hours of post delivery, the women start losing excess of tissue fluids accumulated in pregnancy, and so much so that they lose up to almost 2.25 kgs of weight post delivery. Uh, Decreased tone of bladder, it regains its tone within 4 to 5 days of delivery. So it's very important to drink a lot of fluid, and it's very important to periodically remove the urine from the bladder. So now let's talk about the psychological impact during puerperium. A person has to be very perfect. A mother, she thinks ki everybody is born mother. Nobody is born a mother. We learn along the way basically. So sometimes when everything is not going according to us, the patient may become depressed. During postpartum, for no apparent reasons, a mother may experience a low feeling accompanied by irritability and tears. Her appetite and sleep pattern are disturbed. There are usual manifestations of postpartum or infant blues or depression. It is usually temporary. It can be precipitated by discomfort, fatigue, exhaustion. They all contribute to it. So, what is to be done? Good understanding with the female, family support, and guidance helps in understanding that this is a normal accompanied and mother will come out of it. The emotional needs of the mother should be fulfilled postpartum. Support and encouragement in her care for infant is needed. Attention from family members is needed, especially husband is a must. Physical needs of comfort, nourishment, and hygiene should be properly fulfilled. It is to be done. Sometimes all these may not be helpful in a mother for a mother to come out of this postpartum. She said, yeah, I'm not able to take care of my child and everything. So sometimes you may need expert help also. Sometimes medicines are also needed. It has to be treated. You cannot leave a mother with this thing. Now, what about diet? Common question is, ma'am, am I eating okay? Am I because during pregnancy, a mother take care of herself. In way, I am eating for the baby. Now also you're taking for eating for the baby. You're feeding. So as good as you eat, you will be able to feed the child better. The child will gain that much of weight with how much you're eating. So a diet rich in proteins and calories is needed to restore the strength. A daily requirement of around 3,000 to 3,500 calories per day is needed. And a well balanced diet rich in protein, calcium, iron, vitamin A, B, etc. A good amount of fluids are required: milk, juices, even water. A roughage green vegetables are provided to prevent constipation. You can eat eggs also. A non-vegetarian can eat non-veg food also. It's very good. High rich. It's very rich in proteins. So, very good diet of around 3,000 to 3,500 calories, which is more than what is required during pregnancy, is needed basically. Now, let us come to a very important aspect post delivery, and that is lactation. I've kept it purposely for the last so that we can discuss about it because the maximum confusions are on this topic only. So what happens is during pregnancy, estrogen and progesterones are present in the body. They prepare the breast for lactation. The breasts grow in size. The estrogen it inhibits milk production until the delivery. In the third trimester of pregnancy, colostrum is present and it remains for the first 3 days postpartum. Post delivery, estrogen falls and then milk production starts. So when infant sucks, it takes the nipple and areola in the mouth, and by vacuum action, milk is pushed into its mouth by a teeth-like action. So action of suckling is the stimulation for lactation. Breasts become larger, firmer, heavier, and full of milk that can be expressed as on pressure. Yeah. So every mother should be encouraged to breastfeed the child. Why? It's a easily digestible, germ-free, fresh, warm, containing antibodies, calcium, lactase, fat, minerals, salt water. It's readily available, no cost. Please breastfeed your baby. It's a first milk. It's rich in antibodies. So every mother in our hospitals, in our Apollo hospitals, group of hospitals, we are giving breast milk within first half of an hour of the delivery. We are promoting it. Even in cesarean sections, we are trying to promote this case. So a difference, so breast milk is a must basically. At different stages, it is called the milk, the breast milk. It is called by different names. I'm discussing it because why? Because many of my patients they ask me, "Ma'am, am I feeding good?" मैं सबसे पहले मैं मेरा मेरे बच्चे का पेट भर रहा है कि नहीं भर रहा है मैम हाउ डू आई नो so I would just say if your child is passing urine, if child is passing stool, and the child is not crying because it will give an indication that I am not fully satisfied. So the child will cry. The child doesn't know कि नहीं अभी मम्मी को wait करना है, मम्मी काम कर रही है, so let me wait. Child, it will require milk whenever it is needed. So if the child is quiet, it's comfortable, that means you're feeding good. And if the regular weight on regular checkups, if the baby is gaining weight, then it is doing good basically. So there are two or three type of milks at different stages. It's very important to know about them. Like in the initial 2 to 3 days, the milk it is known by the name of colostrum. It is a thick, sticky, light yellowish in color. It is produced during the first 3 days. It is small in amount, 30 to 90 ml only. सबसे important question, why your child is also small in the first 3 4 days. So whatever you're producing is enough for the child. It is a very important thing to feed that because it is very rich in antibodies. For the next 6 months or so, they are providing antibodies to it. So mother gives protection to the newborn. Please feed that colostrum. It's not wasted. It's not pani. It's something which is very important for the child. Then comes a transition milk for around 1 to 2 weeks following colostrum, and then the permanent milk, the mature milk, which comes after 1 or 2 weeks of delivery. It is mature milk. It is thinner and watery, and but has all the essential nutrients which is required for the physical and mental growth of the baby. It is divided into foremilk and hindmilk. Again, it's I'm describing these two type of milk, the foremilk and the hindmilk, because the both feeding both is important. So foremilk it comes at the start. It is low in fat. It's thinner. It's good in proteins and sugar, and it immediately quenches the thirst of the baby. Baby becomes quieter. It is more than the hind milk, but hind milk is also very important, which comes at the later stage. It is richer in fat, it's more thick, it's more important for the calorie and the growth of the baby. So, feeding both the foremilk and the hind milk is good for the baby basically. So, if the breast milk should be feeded to the baby. Every mother should try to feed the baby. There are so many products coming to the market. They are required at different stages. That is true, but uh, but a natural product nobody can take its place. I'll just try to share some slides of how to apply uh, the baby. Let me see if I can share that. Just give me 1 minute, please. So just till the time the slides are being loaded, let me talk about breastfeeding and the correct posture and the techniques of the breastfeeding. The most important thing post delivery. Why? The government is giving us holidays for 6 months and all that. Why? Because just to breastfeed the baby, take care of the baby. Let me talk about it. Breastfeeding in the correct position. um, सबसे पहले सबसे important, find a comfortable position for yourself. सबसे if you are not comfortable, you will not be able to feed the baby properly. So you may lie down, you may sit on a chair or on the bed or on the floor to feed the baby. Your back must be supported because you are going to take time for feeding the baby. Baby takes long. Don't let the baby play, but it will require average time to feed a baby once is around 20 to 25 minutes. So you must be very comfortable because we will feed around 10 to 12 times, you have more than that also sometimes during the day. So hold the baby in your arm so that the head and neck rest in the bend of the elbow, back along the forearm and the buttocks in your hand. If you're feeding on your right breast, your right arm should be used to cradle the baby. Then the baby's entire body should be turned towards you so that the baby's tummy touches your tummy. Baby's head and neck should be, um, you can put a pillow behind below the baby so that the baby can be raised and you don't have to lie bend down basically forward. Also make sure that the baby is not very clothed so that the baby can be brought really close to the mother basically. Let me see, the screen is coming. I think there's some problem. I'm not able to share the screen. In the last, I'll just share the photographs which is on my mobile, and let's see if I can fix it. Otherwise, we can just Google it on the sharing the screen. So, when the nipple touches the baby's lips or the cheek, your baby's mouth will reflexly open. This is a natural reflex which is present, and that is why we try to feed the baby within half hour of delivery because it's most developed during that time. So, if the baby feeds during that time, then the reflex develops basically. Uh, to effectively suckle the milk from the breast, both the nipple and the areola should go into the baby's mouth. Proper attachment is the key to successful breastfeeding. Improper attachment, it is responsible for most of the problems of the relating to the breastfeeding like sore nipple, congested breast, inadequate milk supply. Right. So I had some images also. A good eye contact between the mother and the child is important. So sorry about that. We're not able to share the screen. There are several. The attaching of this breast, attaching the breast to the child is this is an important step because it is better by the touching, holding, kissing, talking and singing to the baby, to expressing pride in infant, praising the baby. So it increases the bonding between the mother and the child basically. There are three or four positions of breastfeeding also, then a cradle hold, then cross cradle hold, then football hold. Also, post feeding, every baby should be burped at least till 3 to 4 months when till the baby is able to hold the neck. The baby should be burped so that it's not vomiting or doing anything problems. So this is the techniques of the breastfeeding, and there are some very common problems in breast or nipples. If the baby plays taking excessive feed, so some kind problems. A fissured nipple occurs in about half of the nursing mothers at one time or another. Nipple tenderness and soreness are usually the result of trauma and irritation. Their causes are improper antenatal care, improper technique of breastfeeding, unnecessary prolonged lactation, flat or large nipple excoriation, irritating use of substances like soaps, lotion, conditions such as candidiasis, contact dermatitis, and sometimes some females are naturally prone to cracking of nipples. What are the signs and symptoms? Irritation of the nipple in the form of minute blisters or petition spots, persistent pain and tenderness, bleeding, inflammatory signs are there. So, how do we manage that? The proper technique of breastfeeding should be followed. I'll just talk about that. Apply moist heat and massage before feeding. Frequent short feeds to be done. Air or sun exposure of the nipple and breast. Avoid of engorged breast. Avoid irritating materials. Use a supporting bra. Mild analgesics and pentothal ointment may be needed, and treatment of candidiasis and dermatitis. What I wanted to say is that we are providing at Apollo proper physiotherapist and feeding experts. So we can train the mother before delivery also how on the techniques of breastfeeding. It is important for the future of the baby and the mother. We can avoid lactation failure and everything. A proper breastfed child is a healthy child, basically. So, I have, this is my presentation. I've talked about the important aspects, which are the most important questions. If you have any question else, you can share on my screen. I'll try to answer those. So I can see two or three questions over here. Okay, so what kind of food should I have during Puerperium? I've talked about the diet. It should be a rich protein and calorie-rich diet. It should be. There's no. You have taken 9 months to increase the weight, for the growth of the baby. It will take time to decrease the weight. You will lose the weight yourself. Just feed the baby, eat good, a diet rich in proteins, calories, everything. A non-vegetarian can take a non-vegetarian diet. So I've talked about that. Physical changes, I have talked about that also, because weight loss will occur. Most common problem is, doctor, am I going to lose the weight or not? So you will definitely physiotherapists, exercises, these will be needed, but they will take time. It's not that just you have delivered and the next day you are going to be perfectly fine and with all the figures and everything. Just give your body a time, it will regain it. So, how can when can I start physical exercises? I have just said that in our hospitals we have physiotherapists. So post delivery, after 1 day only, we can start with some kind of small exercises. We train them, and all the full exercises can be started after full 3 months. But post 6 weeks, maximum exercises can be started. And from delivery till 6 weeks, we train you in the hospital. You can start with that exercises. Then will the postpartum changes in breast remain lifelong? They will decrease. The breasts will decrease in size once you stop feeding, but definitely some changes will be there. You should be proud. You are a mother, basically. So how do I know that I should contact doctor for any complication during preparing? I think I've talked about that. What is normal? So anything beyond this is an abnormal and should be contacted with the doctor. Any other question I can answer? Uh, Aarti?
Ma'am, one question was there that during this during this period, uh,
Mhm.
can they go for oil massages, hot bath, or
Yeah.
keeping the body? Can they do that?
Yes, that is true. Massages, they are important. It gives a sense of well-being also. Your like lots of pains and aches, they get treated. So a delivery patient or cesarean patient can go for massage, but not of the abdomen. Hand and leg massage they can be done, and the head massage can be done. Of the abdominal massage, it can be done after 6 weeks of your delivery, and back massage can be done basically after post delivery. Just avoid abdominal massage, otherwise massages can be done even in a normal delivery or even in cesarean delivery. So I think there are no other questions. So please, you are most welcome to ask anything extra. I will just try to answer sometimes. And whenever we are going to meet again, then we can discuss about this also. So thank you so much. Thanks, Aarti. I hope I
Thank you,
have
ma'am.
been of a help.
We can conclude the session, ma'am. If there are no more questions.
Thank you so
Thank you,
much.
ma'am. Thank you so much.
Okay.